And good evening and welcome to RFL. I'm Richard French. What a week this has been. We wrap up this week with half the people on the planet on lockdown and the coronavirus spreading quickly, both here domestically as well as in dozens of other countries. And I want to start off with the latest numbers. Here in the U.S., we have roughly 270,000 cases and 7,000 deaths. To give you an idea of how fast this has spread and is spreading, we started the week with fewer than 150,000 people who tested positive and less than 3,000 fatalities. New York continues to have the grimmest numbers. 3,000 New Yorkers have died. That number has doubled in just the past 3 days. We're now under 1 million cases, over 1 million cases worldwide, with the U.S. accounting for about a quarter of them, and roughly 60,000 of those people have died globally. The virus, it has been the most deadly in Spain and Italy, as each of those countries has more than 11,000 fatalities. Now, as we see exponential growth of the cases in the U.S., crucial supplies like masks and ventilators in short supply in many areas. Governors, they're pleading with the federal government for help. Now, this is not a red or a blue issue. Many of those governors from both political parties, and they're all in need, and they're turning to Washington for not just guidance, but for delivery. Governor Cuomo of New York, he made that point today.
Every state is saying the same thing. I need help, I need assistance. So I don't consider this a situation where the federal government is interfering with the state's rights. This is a situation that is by definition, a national disaster emergency situation where the states need and welcome the federal assistance. No state can get the supplies they need. No state can get the PPE they need. No state can get the ventilators they need. The market has literally collapsed.
But instead of going out of his way to help the states that need it, the president, he is again going after the governors who are just asking for help for their constituents. Now, the president's sending a tweet saying those governors are never satisfied. He's telling it, I'm using his words, that the complainers, they should have been stocked up on this to deal with this situation. He also bragged about states that are, quote, thrilled with the job that he is doing. Plus, we are now learning about yet another missed opportunity by the administration of adequate supplies to deal with the pandemic. Washington Post reporting in September of 2018, the administration received detailed plans for a new machine that would churn out millions of medical masks quickly in case they were needed during a pandemic. That was a culmination of an initiative that started during the previous administration to increase supply in case of an emergency. Trump's people did not follow through. And as we've been telling every day here, ventilators are a huge issue here. They're in short supply in many areas, as you well know. The federal government's dwindling stockpile has thousands of broken machines that have been neglected. I want you to listen to Bill de Blasio, the mayor of New York City, describing how dire the situation is in America's largest city.
I can get to Sunday when it comes to ventilators. Monday, Tuesday, I'm not sure about yet. That's the blunt truth, John. But I don't know after Sunday if we're going to have what we need.
Now, many of the city's hospitals, they are becoming overwhelmed, and so are the paramedics. We had a doctor from one of the principal hospitals on the set with us last night detailing the issue. More than a quarter of the EMTs, they are out due to either sickness or injury, but some desperately needed help has arrived. 250 ambulances, 500 workers have just arrived from across the country. New York certainly needs the help and more of it. A paramedic in the city told the New York Post it is a battlefield triage right now. Take a listen to other paramedics describing what they're dealing with.
Dozens and dozens of members who are sleeping in their cars because they don't want to bring it to their families.
I know we're going to come down with this. At this point, it's not a question of if we are going to get it, but how bad we're going to get it.
I have never been sicker in my whole entire life. I've never feared dying as much as I have now.
In addition to the challenges EMTs are dealing with, they're now being told that people in cardiac arrest who cannot be revived in the field should not be brought into hospitals. Think about that. The hospitals, they are too strained to deal with those situations. I want to bring our guest, Oren Barzilay, who you just saw in our setup. He is the president of the Local 2507 uniformed EMTs, paramedics, and fire inspectors. He's also joined by FDNY paramedic Elizabeth Bonilla. Thank you both for joining us. And obviously, thank you what you're dealing with every day. That quick snippet that you saw, the descriptions of what it's like out there, that's your experience too?
Yes, every day for 5 days that I work, 8 hours, sometimes 16 hours, sometimes longer. Our shifts last longer because we have late jobs. But every day we're there.
And it's been described to me that it's nonstop, that the siren never stops. You're going from one place, there's a call waiting, you're going to the next place. There's never a reprieve between stop after stop, and it's the same kind of cases, different ages, but the same kind of crisis you're dealing with.
Definitely. The moment we go available, there's another job awaiting. There's jobs that are holding, that we're ready to go to the next job. Everybody's scared. There's been jobs that I've gone to, people are gasping for air. They are obviously probably in cardiac arrest. People are scared. There's people that even call for anxiety because they're scared. From a stomach ache, it can go from a stomach ache to a sniffle. You know, everyone is scared. Every job is almost like everyone has corona right now.
Oren, if it wasn't bad enough and the palpable fear that we're hearing from people from what they're dealing with out there, I'm going to get to whether they're protected enough in the field in a second, but the calls that are being asked of EMTs to make, that if you can't feel a pulse, you don't take the patient in. Explain what I'm assuming you've never seen this before.
This is a significant change in policy. We are basically in a war zone environment. It's exactly what the military does. You get on scene, you check the army guy or girl, you check for a pulse. If there's no pulse, you move on to the next one. This is what the military does. If we don't have a pulse, we attempt to revive them for 20 minutes. After 20 minutes, they're considered dead on arrival.
We mentioned some helps coming from other parts of the country. Is that, how far short are you in terms of people to meet the demand of what's being asked of you?
So prior to this pandemic, we were screaming for years that we were short. We're doing only 4,000 calls, 4,500 calls some days. We're considered busy. We were already short by 1,000 people. Here we have now days where we're at 71, 7,200 calls with 800 people sick, showing signs and symptoms of the coronavirus. And we're still providing the service because we're working 16, 18-hour days. People are coming in on their days off. If you don't mind, I just want to touch on what you said about not transporting. This is a phase where the public needs to pay very close attention. If we're not taking people to the hospital, there is going to be some significant change in how civilians will see life as is. We're going into a military operation. There's going to be some significant PTSD, not just to the public, but to the paramedics, EMTs, police officers, firefighters. Our main mission is saving life. Our oath was to save life. It's always resuscitate until there's no other means. We start bringing people back to life. We make all efforts all the way to the ER. We have extensive training that we do on the field, in back of the ambulance. Our paramedics are highly skilled professionals. They're street doctors. They can perform some surgeries on the field. We're not telling them that the oath we took of bringing back life ends here. You're not giving that person a chance at the hospital where there's even more extensive procedures that can bring back people life. Imagine me going into your house, your 10-year-old daughter, son, watching us work, and God forbid a family member. After 20 minutes, I have to tell them, I'm sorry, there's nothing I can do for you. That is a significant traumatic event when you do it on a day-to-day basis, when you know that there's other options to save a life. But we understand what's happening. We understand why it's being done. Our hospitals are packed. We now have makeshift morgues outside of hospitals. They're bringing in refrigerated trucks where they're putting bodies with forklifts, stacking them up against each other. This is a military zone now. People are just not aware.
No,
If
and
people are still,
I say this only, we've had ER docs here who have tried to describe the situation of what's going on inside their doors and the realities of everything that we were originally led to believe of this virus and minimized in some corners. And now we learn it's not just the elderly, and it's not a ventilator for a day or two. They're there for sometimes 3 weeks, and we don't have enough. And they showed me scenes from inside the ERs that you have to see to believe, and you guys have lived this. But I have a question for you. So you come on the scene,
Yes.
and we have a chart here to explain it to laymen like me. But if there is a person in full respiratory distress, you got to do chest compressions, right? If you can, if they've got a pulse, you're going to try to help them. We're showing a picture here of a regular person that probably won't emit from a close distance, and you guys are as close, if even closer than doctors and nurses at times. You're right directly in the path of a person who could be emitting the virus. How scared does that get you and your partner and your other EMTs when you're out in the field? Again, to take off his point, you're there to save lives, but also you're putting yours on the line here literally.
Definitely.
Because as we understand it, the more intense the exposure, the greater likelihood of the worst condition you'll have.
Definitely. When they're in respiratory distress, you try whatever you can do to help them breathe. So we have different mechanisms that we can use. We can use the non-rebreather, we can bag them or intubate them to help them breathe. But if they're in cardiac arrest, that's when we would start to do compressions and things
yeah.
like that. I had a few of them. Like he mentioned, it's hard for us emotionally and mentally to deal with this on a daily basis, but we're dealing with this multiple times in one day. You know, there's cardiac arrest coming after cardiac arrest coming. It's more than what it used to be. The core volume for cardiac arrest has increased immensely. Every call is a rush. Every call is an adrenaline. Once you go in there, you basically see the monster right in front of you. You see the actual virus
So
coming.
to simplify it for the audience, you've got almost double the cases sometimes you guys used to have.
Mm-hmm.
You have less people because more people have fallen ill to the actual virus itself.
Mhm.
And the cases you're dealing with are even more intense than you normally have to deal with. And this goes on day after day, hour after hour. So then we get to, and we only have a few minutes here. Oren, I hear it from doctors, I hear it from nurses, I'm sure it's the same for you, the protective gear for your folks in the field. I know you appreciate everybody's fighting the same fight here. How do you navigate the oath you talked about and upholding it when you know it's not the hospitals or New York State that's trying to screw over the EMTs, not giving them what they need, but at the same time you're looking out for the rank and file so that they don't put themselves in danger? Where are we right now, and what can, if anything, be done with it if the federal government's not getting with the program?
well, we are in a predicament. You know, our members again took an oath to go provide service, but we're telling them that if you don't protect yourself, there'll be nobody left to provide for you and for the people on the street. So we enforce them to find some sort of protective gear, whether it's a surgical mask or a N95. We've been telling the city and the department that even that is not enough. We need to go to a higher level of protection. N95 is not keeping us safe anymore. It just covers your nose and your face and your mouth. But the virus is airborne. It can land on your hair, it can land on your eyes, it can land on your clothes, and it lives for hours. So just because you have the N95 mask on, we're not satisfied with that. We want our members to be fully encapsulated with a body gear where they're, no matter what falls, it's gonna land on that gear, on that suit, and they can just take it off and not be contaminated. If you don't mind, to something that you asked Elizabeth, you know, we had members who were positive and went home, and their family members passed away because they got them infected. We have a few incidents like that already.
My last question, Elizabeth, was you got family?
I do. I have a mother and a father who both currently live with cancer. I have a son who has a brain condition. I am scared to bring home this virus to them. Who knows that I'm positive and I walk around with no symptoms. My mother and father depend on me very much. My son depends on me very much. As I was saying, recently, my son just lost his brain surgeon. He passed away not so long ago. He's a very well-known doctor. And now if I bring that home to my son, who would I turn to? You know, so my concern is just bringing it home to my parents. If my parents get it, they're not gonna make it, especially my mom. You know, she's stage 4. And I'm very nervous because she has a home health aide that comes and takes care of her every day. And she takes public transportation. You know, so thankfully my father's good, my mother's good. My son is, you know, we stay in separate bedrooms. If we need to talk, we FaceTime each other, or I speak to him from a distance. I don't give him hugs, I don't give him kisses. But he understands, you know, he's older, he's 22 years old, and he's older. I have a 16-year-old as well who understands, you know, at least they're old enough to understand. Some children don't understand, you know.
These impossible calculations everybody has to make, but imagine times whatever that you live with on a daily basis. First of all, Elizabeth, thank you, and Oren, anything we can do to help to get the word out for what you guys are dealing with. I think finally there's an appreciation for people on the front lines that include not just obviously doctors, nurses, FDNY, NYPD, but the EMTs. So anyway, thank you. And again, anything we can do, please, and stay safe, okay?
Thank you so much.
Thank you.
Thank you.
Thank you.
Before we go to break, speaking of thank yous, I want to tell you about how every local hospital, ours to the studio happens to be White Plains Hospital. If you want to show your appreciation, first of all, stay inside. Don't give them more patients, please, okay? But beyond that, say something at 7 o'clock. Bang pot and pan, do whatever. Let them know you're appreciated. The mayor of that city started an initiative asking everybody to take a moment to make their thanks valuable at 7 o'clock. Thank the nurses, the docs, the nurses, the first responders, and much more. Goes for wherever you're watching us as well here. All right. When we come back, we'll be joined by Congressman Sean Patrick Maloney. He'll tell us what is going on in Washington and also how the people in his district are dealing with COVID-19. How about the money? When is that coming? How are the hospitals faring? All that and more after this.